Good morning. Buenos dias. My name is Marisol Viña. I'm the Director of Public Affairs at the California Endowment. Thank you to each one of you for joining us this morning or afternoon, depending on where you are tuning in from. For colleagues, partners, and community members joining us from Los Angeles, we are holding you in our hearts and sending you love, hope, and strength in these times. Welcome to our first Policy Perspectives webinar of the year, a look at California's 2025 policy and budget landscape. Policy Perspectives is a virtual space where we gather with our partners for conversations on state and federal issues that impact our states and our communities. Policy Perspectives webinars are nonpartisan and non-political. As we know, the policies and actions coming out of DC and Sacramento have a significant impact on the lives of our communities and our state. With a new federal administration, the policy landscape in the next few years will be challenging for our collective efforts to advance health and justice. During today's webinar, our amazing lineup of speakers will help us understand what lies ahead at the federal level and the budget and policy implications for California. First, we are thrilled to have with us Sharon Parrott, who's the president of the Center on Budget and Policy Priorities, one of our partners in DC working to advance economic and health security. Sharon will provide insights on what the federal debates will be, what the threats are, and any opportunities for impact. She will then be followed by Hoene, Executive Director of the California Budget and Policy Center, who's our go-to partner on state and budget matters. Chris will provide insights on the state budget and potential impacts and considerations for California under a new federal administration. And last, but certainly not least, Cary Sanders, who's Senior Policy Director at the California Pan-Ethnic Health Network, will provide an update on the state special legislative session and what policy debates will take place in the state legislature this year. After the presentations, we will invite everyone back on screen to answer questions. So we encourage you all to engage by posting your questions in the Q&A box. We will try to get to as many of them as possible after the presentations. This webinar will be recorded and will be made available along with the slides and speaker bios after the event. All right, I am now going to turn it over to Sharon to get us started. Welcome, Sharon.
Hi, everybody. It's really lovely to be with you this morning. I guess, yeah, it's morning for you. It's afternoon for me. It's great to be with you today to talk about the federal policy landscape and the debates we're likely to see that will affect California and people and communities in California in a very significant way. So I'm going to start by kind of giving you an overview of what some of those key debates are, dive deeper in a few areas, and then I'll be happy to take questions during the Q&A period. So let's just talk first about what are the key kind of policy debates we're likely to see in Congress this year. And I'll get to executive actions, which I know are a big topic on everybody's mind. I'll get to the executive actions a little bit later, I promise. But I do think it's important to understand the very far-reaching debates that will be decided in Congress this year and not only focus on executive actions. So we're going to start in Congress. And I think about the debates that we're going to have in terms of budget and tax and issues that relate to low and moderate income people in two buckets. There's a set of debates that we're going to have because they have deadlines associated with them. Congress has set up for itself a whole series of deadlines this year. And so they have to make a decision one way or another because of these deadlines. And so Congress will address the expiring provisions of the 2017 tax law. If they don't pass a tax law, then the tax code reverts to where it was prior to those 2017 tax cuts for many of the provisions that deal with individual people and families, less so on the corporate side. So there's the expiration of the 2017 tax, key provisions in the 2017 tax law. There's the need to either raise or suspend the debt limit. Congress probably needs to do that by sometime this summer. The expansion of financial assistance that has lowered the cost of ACA coverage in the marketplaces. That expansion, excuse me, that expansion of financial assistance also expires at the end of this year. They need to finalize 2025 appropriations bills. Those are those bills that fund a whole set of key public services and investments, from childcare and Head Start to education to the EPA, a whole set of things that government does. And the Farm Bill, which is where the SNAP program, which we used to call food stamps, rides, the Farm Bill is due to expire. So those are a set of deadline-driven debates. And then there's a set of debates that we will certainly have, though they may not be driven by the same kind of deadlines. There is certainly going to be a discussion about cuts to programs that are on the entitlement side of the budget. And I'm going to focus a lot on the threats to Medicaid, to health coverage through Medicaid and food assistance through the SNAP program. There's certainly going to be debates around border policy and funding, as well as defense funding. And there's certainly going to be a debate around climate investments and the degree to which this new Congress and this new administration may want to roll back some of those climate investments. So let's go to the next slide. I want to talk about sort of the emerging agenda that we see coming out of the new administration and the new Congress. And I want to say that this emerging agenda is not something that's like hard to find. It's very publicly available. There have been recent budget plans put forward by the Republican House Budget Committee, by the Republican Study Committee, as well as new lists of potential tax cuts and cuts to things like health coverage and food assistance that have come, that we know that the majority in Congress is in the House is considering. And so this emerging agenda is emerging in plain sight. So one piece of that agenda is a desire by the new administration and Congress to extend all of the tax cuts that are expiring. And there is a conversation about whether those tax cuts will be offset or not. And then there's interest in adding more tax cuts on top. The cost of just extending the expiring provisions before you add additional tax cuts comes in at $4 trillion over the next decade. And the largest benefits go to people who have very high incomes. So that's the tax piece. And then there is a conversation about cuts. So there's an argument being made that fiscal responsibility demands deep cuts in both non-defense programs that are sometimes called in budget parlance non-defense discretionary programs. And that's that whole set of things outside of entitlements that government does. Public health, transportation, education, all of those kinds of investments in public services. So there's an eye towards deep cuts in that part of the budget, as well as an eye to deep cuts in entitlements, but not so much Social Security and Medicare, although maybe some things in Medicare, but really a focus on things that affect low and moderate income people, like Medicaid, like SNAP, like Affordable Care Act coverage. The new administration and the majority in Congress hasn't shown much interest in extending those enhanced premium tax credits, even though they are a tax credit that make ACA coverage far more affordable. There is an interest in increasing funding for defense-related issues and border, and a strong interest in rolling back climate investments. So that's sort of the emerging agenda as we see it. So let's go to the next slide and talk about the implications. And again, I'm going to really focus on the threats to economic and health security. There are many other implications to debates that we will have this year: immigration policy, access to reproductive health, a range of things. I'm going to focus today in the short time that we have together on economic and health security, threats to economic and health security. So the first is that we will see, and we have already seen many proposals for deep and harmful cuts that will take health coverage away from people or make it cost significantly more. We've seen proposals for deep cuts in food assistance and income assistance that would take that kind of help away from people who need it to afford the very basics. We have a long-term threat of a hollowed out revenue system and an underfunded IRS that will bring down revenues and create more threats and more impetus for cuts in things like Medicaid and SNAP. We've seen proposals for deep cuts in that range of public investments I talked about earlier that are sometimes called non-defense discretionary programs. Those are programs that are funded each year through annual appropriations bills, taking help away from immigrants and their families. And just to be clear, most immigrants without a documented status already are ineligible for most forms of assistance. And so I think we will see proposals that will take help away from immigrants with a lawful status and their families, as well as citizen children based on the immigration status of their parents. As I said, a real interest in scaling back climate. And we will also see executive actions that will also threaten health and economic security. Let's go to the next slide and go a little bit deeper in health and threats to health. I want to start at the national level. 100 million people, that is nearly 30% of all people in the country, get their health coverage through Medicaid or CHIP, the ACA marketplaces, and the ACA marketplaces. So that gets you to about 100 million people. Nearly all ACA marketplace enrollees receive financial assistance. So we are talking about a broad swath of people in the country that get their health care through Medicaid, CHIP, and the ACA. So when you see cuts there, know that those are cuts that can affect a broad swath of the country. A whole series of Republican budget proposals from the new congressional majority call for deep cuts in Medicaid. Proposals that take health coverage away from people who don't document their meeting a work requirement, proposals that would drastically cut funding for the Medicaid expansion for all states and reduce Medicaid funding in California and some other higher income states across all Medicaid recipients. Putting inadequate funding caps on Medicaid, more restrictions for immigrant eligibility, and even trying to cut funding for states that use their own state funds like California does to provide coverage to people without a documented status. As I said, those enhanced premium tax credits expire this year. And if they aren't extended, CBO projects about 4 million people will lose coverage entirely, and tens of millions more will face much higher premiums. Next slide. So just in California, to give you a sense, 13.4 million people get coverage through Medicaid and CHIP. The vast majority of those folks are in Medicaid. So anything that happens to Medicaid nationally will have a gigantic impact on California. And as many as 8.2 million people, or 56% of all enrollees in Medicaid, would be at risk of losing coverage due to work requirements. This is based on an analysis that the Center on Budget has recently done. That would be the most expansive version of work requirements, but you can see that the threat of red tape-laden work requirements that tend to throw people who still qualify for Medicaid off the program could have a very large impact in California. Marketplace enrollment, there are 1.9 million people already that have selected plans for 2025 in the ACA marketplace in California. And if those expanded premium tax credits are not extended, the average per person premium in California could go up by more than $1,100. So this is a very large impact. The estimated increased cost to California in a single year, if the Medicaid expansion match rate is eliminated, is $12.5 billion. And the estimated cost in California, if this proposal that really targets higher income states and their Medicaid funding were to happen, the increased cost is an additional $10.6 billion. So let's go to the next slide briefly, just so folks know that they have it. This is a graphic that we use a lot. You will get these materials later and be able to use it as well. It's just an important reminder of how extensive Medicaid coverage is in our country. This is from that paper on work requirements, and I think somebody asked for the paper, and it's actually linked at the end of the slide deck. But as you will see, if policies that take health coverage away from people, that can't document every month in a very red tape laden way that they meet a very particular and rigid work requirement, can result in millions and millions of people losing coverage, 36 million people nationally, and there's some state-by-state data in that paper that we will share. Next slide, please. On marketplace coverage, California runs its own state exchange. It provides coverage to a very large number of people. What this chart shows you is that with the expansion in the financial assistance, we saw marketplace enrollment go up dramatically. And in fact, when we get 2025 final data, this chart will be even more. You will see that 19.3 million will go over 23 million. So again, an important gain in coverage through the marketplace recently. So let's talk quickly about threats to food assistance. As I said, there are a number of proposals to take food assistance away. Next slide, please. Food assistance away from people who need it to afford the basics. 40 million people in the United States get food assistance through SNAP. And in 2024, that was 5.4 million people in California. There's a whole range of cuts that are being considered, cuts that affect all 40 million recipients, cuts that are, again, trying to take food assistance away from a broader group of people if they can't meet these quite onerous work reporting requirements. There's a set of eligibility restrictions, a set of benefit restrictions, and they are eyeing SNAP, the nation's most important anti-hunger program, for quite large cuts. Let's skip 2 slides and go to threats to income assistance and social service funding. We've also seen proposals to take income assistance away from people through both cuts in the Supplemental Security Income Program, particularly for families with children in that program, as well as through cuts in TANF, which is just a direct cut in the funding that California and other states would get. Also within the income support or income assistance area, we know that that there are many proposals to take the child tax credit away from children who have Social Security numbers, the vast majority of whom are citizens. So to take this child tax credit away from U.S. citizen children based on the immigration status of their parents. And so that's would be quite devastating to those families, and that would be a very large number of families in the state of California. So let's move to the tax debate, which is sort of the other side of these key budget and tax debates this year, right? There's sort of a whole set of proposals to make really deep cuts, and they are very much in service of a tax agenda, right? That's calling for extending all the tax cuts, even those at the very high end of the income spectrum, and even adding more tax cuts on top. And so it's important to keep that just juxtaposition in mind, because that is the critical policy trade-off, right, that policymakers are going to be debating this year. So 3 things to remember about that 2017 tax bill. It was skewed to the wealthy and very large corporations that are mostly owned by wealthy people. It was very expensive, and it failed to deliver on economic benefits that were promised by its supporters. Next slide, please. So the tax cuts are skewed to the wealthy. The average tax cuts for middle class households were far smaller than the tax cuts for the wealthy. And if those tax cuts are all extended and not offset, we will have increased deficits and debt that reduce the capacity and willingness of our nation to address other national needs. On the other side of that, if the way that tax cuts get paid for is by cuts in things like food assistance and Medicaid, we will be paying for tax cuts for very wealthy people by making it harder for low-income people, moderate-income people, people that sometimes are described as working class, that is who will be paying for large tax cuts for wealthy people. And I wanted just to put a pin in that kind of comparison. It's important to remember that large numbers of people that get Medicaid and SNAP, most adults that are working age and don't have disabilities that get Medicaid and SNAP are already working, and many of those who aren't working are just temporarily between jobs. So when people sort of hold up, no, these cuts are just about those people who should be working and aren't, know that that is not how adults that access these benefits, that their typical circumstances. All right, we're gonna skip. You all will get, you can just kind of go through the next few slides, a bunch of pictures that show you some of the realities of the tax cuts, their cost, the ways in which they didn't boost workers' earnings despite promises that they would do that. And so you'll have those in your materials. And let's go to the potential legislative vehicles in my last minute or so here, just to give you a sense of how the debates can play out. So the first thing to say is that there are a number of legislative vehicles where these debates will be decided in Congress this year. There is a process known as reconciliation, which far more people know about than when I first came to Washington, more years ago than I care to remember. But reconciliation is a fast-track budget process in Congress that allows budget legislation, both spending and tax, to go through Congress without the ability for it to be filibustered, and therefore it only requires a simple majority in the Senate. And so this reconciliation process is likely the vehicle that will get used both for tax cuts and for cuts in things like Medicaid and SNAP. So that's kind of one process where the debate will play out. The other process where this debate will play out is in the appropriations process. Those are those annual funding bills that get done each year, always late, always after the fiscal year has started, that fund things that are not entitlements like Medicaid and SNAP, but core public services. And so that process will play out, and there will be intense pressure to cut funding in the domestic areas funded by those appropriations bills. There will have to be some vehicle that carries the debt ceiling increase, and we may also have a farm bill this year, which could also spell real threats for SNAP. Next slide, please. Actually, we're going to go to executive actions. So on executive actions, obviously this week there was a flurry of executive actions that came out of the White House. Some of those reflect real policy changes that are already having an impact. Others sort of set up processes that could lead to future policy impacts, but they will require new regulations to be written or new legislation to be passed. And some were largely rhetorical, but may point to future policy efforts by the administration. Clearly, the themes from the campaign are seen in these executive orders, a focus on a set of broad immigration order executive actions that relate to border, to shutting down the refugee program, to birthright citizenship. Happy to talk about more of that in that Q&A. Very harsh, ugly, mean-spirited executive orders around particularly the trans community. Efforts to make it easier to fire federal and move around federal civil servants, a focus on energy production, and a whole swath of things related to pulling back and eliminating diversity, equity, inclusion efforts across government. Many of those pieces are going to play out over many months, sometimes in Congress, sometimes in the courts. But there are a lot of other executive actions still to come that will be regulations and waivers and other actions. So last slide, trying to zoom through here. The last thing I'll just say is, for me, this is a policy agenda that is emerging that is deeply troublesome. We could increase the wealth of the wealthiest, increase poverty, and make it harder for working families to make ends meet. And that policy priority juxtaposition is extremely clear. But what I want to leave you with is like, is the reality that while that is the emerging agenda, that does not have to be the final say in what happens this year in Congress. There are lots of opportunities to engage in this policy debate and lots of opportunities to affect it. Many pieces of legislation will require bipartisan majorities in both the House and Senate for them to pass. There are very slim margins. Some bills will require 60 votes. And there isn't unanimity among the majority or the public on many issues. Cost shifts from the federal government to states are going to be problematic in red states and blue states. Cuts in Medicaid and food assistance shifts problems and costs to states and localities, health providers, rural hospitals, and food banks. Millions of people across the country need help to make ends meet, and those people live in red and blue states and red and blue districts alike. So there are lots of opportunities to affect what happens in Congress, to affect executive actions and regulations, and many things will be fought out in the courts. And all of that is incredibly important, both to helping to shape the policy outcomes in the near term and also to laying the groundwork for a positive agenda that supports families and communities into the future. So I will stop there. Thank you so much for having me today. And I'm going to turn it over. I almost forgot my last duty. I'm going to turn it over to a dear friend and colleague, Chris Hoene, who I have the opportunity to work with quite often. He's the executive director of the California Budget and Policy Center.
Thank you, Sharon, and thanks for being with us today and making some complex and troublesome information so easy to understand, and we appreciate the materials. So I'm now going to try to do the same thing at the state level where there's a little bit less news, but I'm going to walk you through the latest news that we have from Governor Newsom's spending proposal that he put out in early January, and want to start by just making sure you hear some key messages from us about what we think about Governor Newsom's proposal. The first is that state leaders have an opportunity, and we believe an obligation, to improve economic opportunities and well-being for all of Californians, regardless of the budget condition of the state. The governor's plan does a fairly good job in some respects of that by upholding some past commitments and important investments that state leaders agreed to over the past decade. But we also think that the governor's proposal, at least in its early iteration, is missing some opportunities to take a bolder approach, particularly to take a bolder approach given what Sharon just outlined and the potential threats coming at the federal level. We think the state's tax system and spending choices could be better structured to combat glaring inequities and high levels of poverty, particularly by ending tax breaks for wealthy people and corporations, particularly in the federal context where we know they're about to get a pretty large extension of a tax cut, maybe even some expansion of tax cuts. And we think there are some questionable spending choices still in the state budget, like the governor's proposal to expand the film tax credit for film studios, that should be seen as trade-offs against helping working families make ends meet in our state. I'm not going to say very much about this. The governor has said a lot about trying to reform the state's rainy day fund and its spending limit. We're generally supportive of that. We think that there's a smart approach there. I'm not going to focus on that today. Happy to talk about it in the Q&A. But let's talk a little bit about the federal context part of this and why we're somewhat critical of the governor's proposal. And it has a lot to do with what Sharon just outlined, which is there are a lot of federal policy changes or potential federal policy changes that pose risks to California, either to the economy overall through things like tariffs and the effects of deportations on workforce, the revenue outlook of the state, whether that's because of federal cuts or removals of revenue or economic shifts, and then the well-being of Californians simply because people may lose health care, food assistance, or other vital public services. There's also sitting out there this uncertainty regarding federal disaster aid that was a big issue during the campaign and since the LA wildfires have become so problematic. And why this all matters is because federal dollars that come into California are a significant part of our state budget. And you can see that in this next slide, where basically for every $2 that we spend at the state level, there's another dollar that comes in from the federal government. So federal funds that come in are particularly important in our state, and they are particularly important for health and human service programs, and within that for Medicaid and providing health care. Next slide. So let's talk about the kind of key building blocks of the governor's plan. The general fund revenue, the sort of checking account for the state, the governor projects to be $16 billion plus higher over the 3-year budget window. That's last year, the current year, and the next year. So that's good news after a couple of years of deficits. The governor's proposal would assume that we're still withdrawing $7 billion from the state's constitutional rainy day fund, which leaves about $11 billion left. So we're still in pretty good shape there. And would leave about $4.5 billion in the state's main discretionary reserve, which is a reserve account the state can use for emergencies and economic uncertainties. Overall, the budget ends up mostly balanced, a small surplus of about $350 million. That's a small surplus on a $220 billion general fund. So it's sort of like having a flat budget overall. Next slide. So let's talk about some individual policy issue areas. Good news in the health arena is that there are no healthcare cuts in the governor's plan. The potential threats coming from the federal level had the threat of state leaders maybe removing some of the expansions of the Medi-Cal program or Medicaid in our state to some populations, including undocumented Californians. But the governor's plan maintains all of those earlier expansions and key investments. There are these federal threats looming out there, particularly to Medicaid. And we recently, voters passed Proposition 35 in November, which made some changes to the managed care tax. And that could be threatened by federal issues as well. But the governor's proposal assumes the implementation of things that voters passed and that were expanded and invested in earlier years. We'll talk about economic uncertainty, or I'm sorry, economic security programs next. One more health program I did want to talk about. Yes, there is a new proposal or a continuation of a new proposal in the governor's plan, which calls for a new BH Connect program, which is an expansion of behavioral health services for Medi-Cal members who have significant needs. That's part of a longer term plan the governor has been putting in place to expand behavioral health initiatives overall. And some of those earlier investments are all continued in the governor's budget, plus there's the launch of this new BH Connect program. So we'll next talk about economic security. There's not a lot of new news here. There's no cuts, but there's no expansion. So there's no major changes to food assistance programs. The state's moving forward the expansion of its own independent California food assistance program, which sits on the side or next to SNAP or CalFresh. There's been some expansions there to certain parts of undocumented communities in the state. Those continue to go forward, but there aren't any new investments either. The governor's budget maintains a commitment to child care slot expansion that has been included in earlier budgets, and some rate increases for providers continue to be in there. And there's a small increase in CalWORKs that was required by previous legislation. But as the next slide shows, there's really nothing new here either. And this is a place where we're concerned that the governor and state leaders may need to respond. And there isn't any signal from the governor yet about the ability to do that. If the federal government cuts things like food assistance programs and Medicaid in significant ways, the governor and state leaders are going to have to figure out what they can do to cover some of the lost public services to the folks who need the health care and need that food assistance. And so that by come May and over the course of the legislative process, we think they're going to have to talk more about economic security programs and how they're going to respond to federal threats. Next slide, we'll move on to the governor's approach on housing and homelessness. Kind of a similar theme here, that there's not a lot of new news. The bad news is actually that the governor's proposal actually abandons a set of state investments for housing that had been made in prior years. There had been one-time funding that had been put into housing and homelessness programs that's now expiring, and the governor's not re-upping that funding. He's creating a new housing and homelessness agency. Not clear exactly what that's going to look like. And there's an implementation of Prop 1 that voters put in place that allows using behavioral health funds at the county level for housing. So that's all there on the housing front. On the homelessness front, on the next slide, they're kind of a similar thing, no new meaningful investments. There's the continuation of some things from earlier budgets, $100 million new in encampment resolution grants, which is basically cleaning up encampments in cities. So that's the only place that there's some new funding. And I'll breeze through a couple of things here real quick. In education, a lot of you know that when the state's revenues go up, our constitutionally required formula to fund K through 12 education and community colleges automatically goes up as well. So there is a boost in K through 14 funding from Prop 98. So that's just shown in this slide. There's a series of other things. Short version, I'll just say here on the early learning side, the governor's commitment and state leaders' commitment to universal TK and pre-K is continued to be funded and is part of this budget. And then there are some other investments in K through 12 that are enabled because of the automatic formula increase in K through 12 funding. In the higher education arena, on the next slide, won't spend a lot of time on the left, but do want to note the big news here is in the financial aid world, where there's no continuing effort to try to reform the Cal Grant program that provides funds to low-income students who are trying to access the state systems. And there is the continuation of a planned significant cut to both CSU and UC that was in last year's budget and that is continued in this year's budget as well, that will affect financial aid and access to those institutions as well. So that was a part of how they resolved last year's and the prior year's deficits. And then next slide, we'll talk lastly here about the justice system. The news here is that voters passed Proposition 36 in November, which rescinds some of the criminal justice reforms that had been made in the last decade, and that many thought would be projected to increase numbers in the correction systems. The governor's projection is actually saying no, they're not projecting a significant increase in the population in the correction system, and they actually think that those numbers in the state's prisons will actually continue to decline in future years. That'll produce some cost savings. That's due to some of the other reforms that weren't rescinded, but the governor doesn't propose any new prison closures either as part of the savings there. So not a lot of news in the justice system, but the governor doesn't think Prop 36 is going to result so far in a big increase in the prison population. So what's next? I'll close just by saying a little bit about process here. From now through early May, there'll be a whole series of legislative budget subcommittee hearings. This is when the legislature gets to put their budget plans forward, where the general public, advocates, organizers get to have their say. That'll all play out over a series of months. By May 14th, the governor will come out with his second bite of the apple, the May revision to the proposed budget. We'll know a lot more then about state revenues, and he'll have an opportunity to respond to what the legislature and advocates have been saying. They'll have to finalize all of that budget work from late May into early June. Legislature has to finish their business by June 15th. And then the governor and then legislative leaders have to reach a deal so the governor can sign and enact a budget package by July 1st. So that's the process we're working on. So we're going right now into the big arena where all of you have a chance to actually have an opportunity to have your say about what's in the governor's budget and about how the legislature responds, either through hearings, contacting your folks in the legislature, working with your coalitions and networks, etc. So lastly, just real quick advertisement. If you want to find out more about how that's going, we have an annual policy conference, Policy Insights, that will be held April 10th in 2025 in Sacramento. Our first look publication, which has a much more detailed analysis than I've shared with you here about what's in the governor's budget, is also available to you. And we have a set of resources on our website to help explain the budget process, some of the terms, the timelines, et cetera, that you can also access. So thank you very much. And I'm going to turn it now over to Cary.
Thank you, Chris. And thanks everyone for being here today. Cary Sanders, Senior Policy Director with the California Pan-Ethnic Health Network. Hopefully my slides will be up soon. Okay, great. So just a little bit about CPEN. We are a statewide multicultural health advocacy organization, and we ensure health justice and equity are on the agendas of policymakers, and our communities are part of the policymaking process. I was asked today to provide a special session update and a snapshot of California's 2025 legislative priorities. I also want to take some time to share how advocates are responding to federal healthcare threats, as well as what you can do to get involved. And so on this slide, you'll see here, as many of you know, shortly after the election, California's governor called a special session to respond to anticipated attacks by the new administration on California's values. Really the focus, if you could stay on that, yeah. The focus of that special session was really to address civil and reproductive rights, threats to climate change, threats to withhold disaster relief dollars, and the repeal of deportation protections for immigrants of all backgrounds. Initially considered a $100 million package. Now it's looking more like it's a $50 million package, $25 million in the Assembly for certain aspects of that agenda, and then $25 million in the Senate. The Assembly is really around protecting these rights, and then $25 million for legal services related to immigration defense, as well as other disputes such as wage theft, evictions, and workplace protections. Then with the fires, the recent fires, we now, the governor and legislature have actually added to the conversation an additional $2.5 billion in funding, some of which could be reimbursed federally, but in order to provide shelter for evacuees and to prevent post-fire disasters, particularly in the Palisades and Altadena regions, which were horribly impacted. Legislative hearings are happening this week, and so this is a very dynamic situation, but things are certainly moving forward in that direction. Next slide. So as for our legislative priorities, there's really three areas that I would just call attention to for this year. One is a focus on affordability. And really, when we think about the election, economic issues were a top concern of voters in the 2024 election. But we know that healthcare is a major driver of economic instability as healthcare costs depress wages. Medical debt continues to drive personal bankruptcies, leading to loss of generational wealth and ultimately poorer health outcomes. So legislative leaders have indicated an intention to focus on an affordability agenda this year, but this must necessarily include healthcare. We know that this is a problem. Affordability is a problem whether you're insured or not. Californians with employer coverage have been shouldering an increased portion of annual premiums that have more than doubled from 2000 to 2017, or tripled for smaller businesses. So in other words, having health insurance doesn't necessarily result in being able to use that care because of simply it's out of reach for many families. So three areas that I would focus on under tackling affordability. One is our Office of Healthcare Affordability. The board last year approved a statewide spending target of 3%. In order to try to keep healthcare spending in line with wages, with what average Californians are earning. And they'll be deciding this year on sectoral targets, such as hospital costs or other high costs that are contributing to driving up healthcare costs in order to bring down the cost of care. Medical debt is another critical area of focus. We know that more than a quarter of Californians, or 10 million Californians, said that they or someone in their family had problems paying for medical bills, and those numbers increase for communities of color. The end result is that more Californians are skipping or delaying care, and nearly half of those who skipped care reported that it made their conditions worse. So we really need to work this year to curb medical debt by requiring hospitals continuing to work to ensure that patients are pre-screened if they're eligible for charity care, and making it easier for them to get the assistance they need. Lastly, with federal threats to the enhanced subsidies, which Sharon touched on, we have a fight ahead of us to maintain our subsidies at the federal level, while also looking towards state funds to ensure that consumers are not suddenly saddled with a premium increases of over $1,000 a year, or see their copays go up for things like doctor's visits or emergency room visits. Commitment to equity and inclusion. Briefly, we know that California's Health and Human Services Agency has made a clear and explicit commitment to advancing equity, including racial equity. And in 2022, CPAN was commissioned to conduct a landscape assessment of California policy efforts to advance equity. As part of that assessment, we reviewed published materials, legislation, and conducted interviews with representatives from various agencies. And our research uncovered interest in significant activities by the governor, legislature, and agencies to advance equity. But more needs, despite that progress, there are lots of opportunities that still remain. For example, for greater alignment between agencies, for improvement of the ways that we quantify and address disparities, and better engagement. So while the Trump administration has indicated their intention to undermine decades of civil rights, equity, and inclusion work, California cannot and will not go back. We need to keep these issues front and center for policymakers by right-sizing the legal risk, using data and stories to demonstrate both need and impact, and helping both the public and policymakers understand why equity improves the well-being of all Californians. Lastly on the list is protecting our rights, and that includes immigrant rights, transgender rights, reproductive rights. The attacks on our communities are not unexpected, but they're nevertheless devastating. Fortunately, California has a number of policies in place to counter these efforts. For example, the Attorney General has policies on safeguarding sensitive locations from immigration enforcement. Non-discrimination rules in California have been, are in existence. Abortion and LGBTQ rights are in our state constitution. So, it's important that we not panic and take time to truly understand the impacts of policies that are coming out of this administration. We know from firsthand that many of the policies are designed to stoke fear, regardless of their limited tangible impacts. And this is true of other things that we can expect. Next slide. Okay, so my last few minutes, I'm going to try to rush through a few things. The biggest threat to our healthcare, as Sharon and Chris have talked about, is the threat of loss of funding. Maybe a small silver lining is that, California passed a slew of bills after the first federal Trump administration took effect in 2017, and pledged to repeal and replace the ACA in order to shore up our state's commitment to making coverage accessible to all. And here, these are just some examples, but I include a reference to a fact sheet that provides more information. But for example, California upped state funds for marketing and outreach for enrollment assistance at the same time that the feds were taking funds away. We maintained our 90-day open enrollment period as the feds were looking at shortening that period. We banned the sale of short-term insurance and junk plans. We also shored up our state's civil rights protections in the midst of federal attempts to rewrite them. And so these are really important actions that we've taken. Next slide. But as we look at, the federal threats, we know that our Medi-Cal coverage and Covered California coverage is at risk. Of the nearly 14.5 million Medi-Cal enrollees across the state, 4.9 million, 34%, a majority of communities of color who are disproportionately uninsured prior to the ACA are able to enroll in Medi-Cal because of the federal and state expansions. And so, you know, if Medi-Cal proposals pass, we could see more than 5 million Californians losing their healthcare coverage. And that includes access not only to physical healthcare, but to mental health, substance use, and dental services through Medi-Cal. Next slide. Similarly, we see on the Covered California side, if the IRA enhanced premium subsidies expire, subsidies, 1.7 million Covered California enrollees could see annual premium increases of $1,000 or more. And that, you know, could lead to folks falling off of coverage, fewer people actually being able to access their healthcare coverage because of higher costs that they're forced to pay. Next slide. So what can you do? First and foremost, share your Medi-Cal story or your Covered California story. But we're particularly interested to know, how has Medi-Cal helped you, your family, the populations you work with? What would it mean for you, your family, or individuals if Medi-Cal were to go away? And where, you know, we are very interested to understand the impacts by region, in particular, thinking about where some of our congressional, leaders live who may be interested in voting against communities and against consumer interests. Also, staying up to date, CPAM will be sharing updates and opportunities to engage throughout the year. And for more information, you can go to our website. Next slide. I did want to just say a few words on the executive orders, which Sharon also talked about. As folks know, as folks have probably heard, Trump signed several orders on immigration on Monday. And as I mentioned earlier, as hard as it may be, it's important that we not panic and take time to truly understand the impacts of these policies. First and foremost, many of these efforts will take time to implement and could face many challenges, including legal and fiscal challenges. And one example is the Department of Justice and California groups, for example, have already, and 19 other states are suing over at least one of the executive orders on birthright citizenship. But similarly, you know, any efforts to increase federal immigration enforcement are going to require additional funding. And that, you know, is going to be that will be a separate conversation. Next slide. Oh, sorry, before we move on. So I want to just highlight some national resources, but also know that there are a lot of state and local groups on this call. I see you and I appreciate you and recognize all of you who are working to empower your communities to fight for their rights, while also recognizing the real and legitimate fears and supporting communities to cope with these. So these are some national Know Your Rights resources that are circulating. And next slide, as well as some legal assistance resources and toolkits. You can also stay up to date on federal immigration policies through the Immigrant Hub .org. Or the immigrationhub.org. And there are many other groups as well that are, you know, working together on these issues. And with that, I think that concludes my presentation. I want to pass it back to Marisol. Thank you.
Thank you, Cary. And let's invite Chris and Sharon back on screen. You all have provided us such a wealth of information, and you know, the first place to start is to have the information. So just appreciate all three of you for really breaking down these very complex issues and empowering us with information. Let's see, I love and appreciate that our panelists have answered many of the questions in the Q&A box. Thank you so much. We do have a couple that I would like to, bring up. And one was in the chat regarding the budget process. And Chris, I was wondering if maybe you can speak a little bit to that in terms of timelines on when the public could get engaged in those public hearings and making their voices heard, sharing their stories. on that process?
Yeah, I believe the question specifically asked about can you provide a written perspective and provide that, and the time to be doing that is actually in the coming weeks. So the budget committees and subcommittees will all start meeting here in the next week, and they'll be meeting through early May. And the really pivotal time in there is sort of early February through like late March. And so if you can't be in Sacramento in person or show up to provide testimony, you can provide written information to your legislator or to the committee chairs and their staff. So there is a way to provide written perspective, and that will be received and taken into account. We watch testimony and the efforts of people to reach their legislators change the budget proposals every year. So I would take that very seriously and encourage you to provide that written and or in-person response if you can.
Great. Thanks, Chris. And I also saw there was a question on the birthright citizenship executive order, and I saw Sharon put in a late breaking news in the chat. Sharon, I don't know if you want to say anything in addition to that.
Sure. I'll just say, and Cary may have the details better than I do, so definitely jump in if I get them wrong. But the executive order, so the 14th Amendment passed in the 1860s, ratified in the 1860s, provides that any child born on U.S. soil that is subject to the laws of the United States is a citizen. And that is why we, unlike some other countries, don't have sort of a group of people that are born here that are not citizens. And so it's been a bedrock. The amendment was originally enacted to ensure that the children of previously enslaved people were full U.S. citizens. So what the Trump administration has said is that they believe that children born of parents who are undocumented or parents here in certain lawful statuses but temporary statuses do not have they should not be U.S. citizens, and they believe that they can do that through executive order. I would say most lawyers don't agree with that. There is a court case on point from the 1890s on this. And so there's some nuances. You don't have to have both parents be citizens. You could have one parent be a citizen or one parent be a lawful permanent resident. But the basic idea is that children born to both people without a documented status and then certain people that are here in a documented status but on a temporary status would no longer be U.S. citizens. It would mean that some people would be stateless, right? Because they would be born, they wouldn't be citizens here, and they wouldn't be citizens in whatever country that is not their home country because they were born here, so they have never known another country. So the late breaking news is that there's been a 14-day restraining order on the administration moving ahead. That's just more a signal that this case is going to proceed, but it is a nationwide injunction and a good first step. So Cary, you may know more than I do.
That was a good explanation, but I know others that are listening in may be even more experts than us. So appreciate the question.
Yeah, thank you all so much for the questions, and thank you to our panelists because this has been very rich and just a lot of interest, and unfortunately we are at time, so we don't have time to get to any of the other questions, but our panelists have done such a great job in trying to answer as many of them as we can. Thank you so much. Our deep appreciation to Sharon, Chris, and Cary for this information and for your insights today. We certainly have our work cut out for us. To our audience, thank you so much for joining us today. We appreciate your time and all the work that you all do every day to support our communities, and particularly in these times. As a reminder, we will be sharing all the slides, the bios, the recording, and then resources at the end of the webinar. But we do want to encourage you to please take a moment to fill out the survey. There's a link on the chat, and there's also a code on the screen. And we would really, really appreciate hearing from you on future topics and any feedback that you may have for us. Any information that would be helpful, anything like that. So thank you so much. We really hope to see you back at our next webinar. Have a good day. This will conclude our program.